I'm sure you've been there, you're about to leave the house and then bam, Crohn strikes and you need to rush off to the loo again. But what happens when your incontinence strikes in public? How do you go about dealing with that? Well, stick around as I'll be giving you my top tips on how to manage incontinence when you have Crohn's disease or ulcerative colitis. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information, so make sure you hit that subscribe button and the bell to be notified every time I post a video. And if you want to join the exclusive community of people who receive my personal tips and tricks on living with Crohn's disease, then make sure you sign up to my newsletter by hitting the link in the description box below. Now, one of the ways to stay ahead of incontinence is to always be prepared, and one way you can do that is by having an emergency travel kit. If you want to know more about this and what I keep in my personal travel kit, then make sure you check out this video, and I reveal in that video the one item I cannot leave the house without. Right, now there are a few things that you can do to improve your tolerance to incontinence, and just remember that what works for one person may not work for another, as we are all different and react differently to different things. So before we get started, just remember that going to your doctor or IBD team for the advice should be the first thing that you do. Now, one of the most obvious things to do is to try and make sure that your bowel is empty before you leave the house for school, uni, work, or even social events. You could also try bowel retraining, and this is essentially where you try and hold it in when you have the feeling to go to the loo. And what this is doing is training your muscles in your backside and your sphincter muscles to develop and cope next time you have an urgency. This can also be helpful if you hold on in the final seconds of when you eventually do find a toilet. So pelvic floor exercises can also be useful, and some women who use these help strengthen their pelvic muscles after they've given birth, and they can be helpful in managing incontinence as well. And what they are essentially helping to do is strengthen the muscles around your anus, allowing you to manage your incontinence. But you do need to do these exercises correctly, so it's important to discuss this with your doctor, who will be able to pass you on to the correct healthcare professionals. Now, you can also try diet changes. I won't say much on this because I've done videos on managing bloating and diarrhea, which you can find in the links in the description box below, but the principles I mention in those videos are also relevant here. Another option is taking anti-diarrheal drugs, which help in making your stool more firmer and reduce the number of times you need to visit the loo. But you shouldn't be taking these if you are in a flare, as complications can arise, and it's best to check with your doctor what over-the-counter medications you can take, because some may not be agreeable depending on your type of Crohn's disease or ulcerative colitis. And there you have it, just a very few tips on managing incontinence. As mentioned, I have done other videos which give you additional tips and tricks on managing diarrhea, constipation and bloating, and you can find the links in the description box below. But now make sure you check out these videos for more useful tips, tricks and information on Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this video and found it useful. And I can't wait to see you all in the next episode.